Welcome to Season 2 of Around and Around the OCD Circle podcast. My name is Elizabeth, and I have been living with obsessive compulsive disorder for over 60 years. I am not a therapist or a medical professional. Each week, I will document my struggles and successes while having OCD. I will also speak with ordinary people, just like yourself, from around the globe, who have graciously agreed to share their OCD stories with you. I feel certain you will relate to some or all of their experiences. If at any time you feel like hurting yourself or ending your life, please call the 988 Suicide and Crisis Lifeline by dialing 988 if you are in the United States. It is open 24 hours a day, and you will be connected with the nearest crisis center to receive immediate counseling and local mental health referrals. Now, on to today's episode. Welcome, everyone. I hope your day is getting off to a great start. We are now in Season 2 of this podcast, and we've had some amazing episodes so far. And I hope you have been enjoying the midweek motivation on Thursday mornings. Coming up the next few weeks will be my conversations with Josh Kirschenbaum and Zachary Gittleman. I will also be talking about my recent obsessions and how I dealt with my OCD when I had COVID, so I hope you will stay tuned. Today I am speaking with a young woman named Kaur. Her family is from India and she is in her 20s. She has an amazing story to tell, struggling with depression, OCD, and being diagnosed with borderline personality disorder. She is taking control of her future by switching to a new treatment center. I was very impressed with this young lady's resilience and her hope for the future. Let's take a listen. Welcome, Kaur.
Hi,
Thank you for joining me today.
thank you for having me.
I'm excited to get to know you a little better. I actually know nothing of your story. And so I'm just going to ask you to, just introduce yourself, and you can just tell us where you're from, what you do, anything you want to share, just basic backstory. Want to do that?
Yes, sure. Hi, I'm Kaur. I live in New York City. I moved from India with my family at the age of 7, and I do have a degree in elementary education, but I am in the middle of changing careers and figuring out what works for me because my mental health kind of got in the way of my career and still figuring out what to do, but that's my current situation.
All right. Have you taught at all since you got your degree?
Yeah, I taught for 3 years, I would say.
Mm-hmm. That was my degree as well. And I taught for many years, but there are many times that the classroom was a very stressful situation for me with my OCD.
Yeah,
So,
same thing happened for me.
yeah. What kind of situations kind of triggered you? Do you remember?
Um, so my first job, I ended up losing it because basically I had this intrusive thought. This kid was being really immature. Well, he's a kid obviously, so he has every right to, but kind of triggered me a lot. And then I had a thought of an intrusive thought almost, which kind of I shouldn't be thinking, but I ended up saying it aloud to him, which ended up him telling his mom, and then the mom telling my boss, and he ended up losing it. And I have tried different jobs. Either I end up leaving because it's very stressful and I get very sensitive with my triggers, especially around children, such as pedophile OCD, that how it happens, or responsibility OCD, where I just feel a lot of guilt that I'm not doing enough. And yeah, it's either I leave the place or I get fired. So I'm like, this career is not working for me, so I need to stop.
Mm-hmm. I did an interview recently with a gentleman. It hasn't been aired yet, but maybe after we record this, who had the pedophile OCD. So you might find that a little interesting as well.
Okay.
Might be able to relate to that. That's why I try to interview as many people as possible because there's so many different ways OCD can manifest itself. That you might find yourself in someone. And I'm hoping that someone relates to you. I bet they will.
Yeah, it's like interesting how like OCD is like different for everybody, but then it's also like the same like common ground where we're just struggling with anxiety and like the thoughts. Like for
Hmm.
me, the thought that I've always had since childhood is I'm a bad person. Until this day, that thought hasn't gone away. It has like gotten, I guess, a different meaning to it. But
Hmm.
yeah, that is like the main reason I think like I would do behaviors or act out in my OCD.
Hmm. So right now you're taking a break and do you have an idea about what you want to do?
Um, I wouldn't say I'm on a break. I've been going on a lot of interviews, waiting to hear back. Just seeing like whatever happens, happens. I'm not open to working in a very fast paced environment. I really want something slow where, such as like, a receptionist where I just have to like make schedules and answer phone calls. And I really want something where I'm working alone and not with people because I also struggle with relationships and because I am also diagnosed with BPD, so I struggle with interpersonal skills and it always creates a conflict between me and a coworker. So I'm trying to find something where I can do something independently and still not like it being like this multitask. I can focus on one thing at a time.
Hmm. And nothing that has like a lot of deadlines. Do deadlines create stress for you?
I actually thrive on deadlines. Like,
Oh, you do? Okay. Okay.
yeah, if like I'm not given a deadline, I will probably end up never doing it until that person texts me and like, can you send it to me? But I like having a routine and structure, which I think is like my OCD as well because it's like routine, right? I repeat the
Hmm.
same thing. So having like a structure and a schedule to follow, I really like that and I thrive. I think I did really good in college, to be honest. Like I always been a really good student and I never had trouble in school at all, which I'm really surprised about.
Hmm. Okay. Let's talk about your early years. Like, do you remember the symptoms starting when you were really young?
Yeah, so I moved to New York when I was age 7. This was my first time living with my father, and which ended up becoming a really stressful environment for me personally. As like a
Hmm.
child, being in this like there were like a lot of verbal abuse, physical abuse, and I don't know if that's the reason my mind was like kind of getting triggered and my OCD got triggered, but I remember like performing the same acts that I do till this day at that age. I can remember, obviously with different objects and different things, but it was there. Like, I remember when I would play with my toys, I would like tap the toy like 3 times before getting up, or like something bad's gonna happen. Or every Sunday, I would ask my mom, I'm like, Mom, I think something bad's gonna happen. And another thing I really struggled with was asking my sister, my older sister, like, hey, like I touched this thing. Does that mean I need to wash my hands? And nobody really realized why I was asking that, but that question was asked probably like 30 times a day as a child.
Hmm. How did they respond to that when you just continuously asked them?
My family is not very well aware with like mental health, to be honest. So when I would ask this, they would just give me reassurance, and my sister would just say, "No, you're okay." Obviously, she would get fed up, and she's like, "Can you stop? Like I already said no." And but then she would still give me a lot of reassurance, and my mom would be confused when I would say, "Oh, like today's gonna be a bad day." She was like, she was not able to understand why I would say that, but I guess she like
Hmm.
overlooked it and was like, "Okay, like she's probably a child overthinking," and like nobody really realized it was like mental health. issue.
Hmm. So, how old are? Is it okay if I ask you how old you are?
Yes, I'm 26.
Okay, so what year were you born?
1997.
Okay, so I'm trying to think about what things were like in 1997 as far as mental health. I mean, they at that time they are obviously aware of OCD um, in the mental health community. Did they? Well, let's go back a little bit. Did it affect you in school at all?
Yeah, I remember the same thing whenever I would do like this activity or like play with other kids. Again, there was a lot of tapping on stuff over and over again. And my friends was look at me and they like, "What are you doing?" And I would get embarrassed, but I wouldn't really explain myself. And a lot of like checking and rechecking, like did I did that right? Did I did that wrong? And
Hmm.
something that is like still happening to me till this day is like the hand washing. That has never gone away. And obviously, I'm able to not wash my hands like multiple times a day, I would say, but the routine is still there that I have to wash it in a certain way, like I did as a child. Like that has manifested and stayed constant.
Hmm. Were you a good student in elementary school?
Yeah, my teachers loved me. I was new to New York in elementary, so obviously I didn't know English. So the teachers definitely gave me a lot of attention and a lot of care and just like helping me learn English. And I was able to learn English within 2 years because the teachers were like so hands on. So it was really helpful.
Wow. Okay, so do you did you get diagnosed with OCD when as a child, or did your parents take you anywhere or did you just live with it all that time?
I lived with it. I remember when I was a freshman in high school and I got fed up. I'm like, okay, this is too much. And I Googled it. I Googled all my symptoms. That was my first time. I think I was 15. I read OCD and I remember going to my best friend as a freshman. I was like, oh, like, you do know, like, I have OCD? And she's like, she knew everything about OCD. And she's like, yeah. And I'm like, okay, like, at least I told somebody, I felt relief. And, but it wasn't until I got to my first semester of college, I was 18, and I was like, okay, I need therapy, but obviously I don't know like where to get therapy. So I started going to this college counselor and I told him like I struggle with OCD and that was like the first time I shared anything. But obviously he wasn't trained with OCD, so it was just talk therapy. And it got really bad when I turned 21, like really, really bad. And I was like, I need medication. So I found this random clinic and I went to the psychiatric. I'm like, hey, I need medicine for OCD, and I still don't know why they didn't like the testing on me or anything diagnosis. They accepted I had OCD and started me on SSRIs. It
Wow.
wasn't until I turned 23 when I got hospitalized because I had a really bad breakdown because of my OCD, and that hospital was like the first time I got proper therapy and psychiatric, and they were like they were confused too that why wasn't I tested, and they did testing on me, and that's when 23 was like officially diagnosed with OCD, severe depression, and then a year passes by also with BPD. So it was like not until I was 23 that it was on paper officially.
Hmm. That must have made you feel good because you actually had a name for it, right?
Yeah, like I think like seeing it on paper, like you're diagnosed with OCD confirms like my fear of like, okay, this is real. This wasn't in my head, and now I can get treatment for it.
So, what are you still in some type of treatment?
Yes, I'm in the same hospital. I'm thinking about changing it to be honest because I never did exposure therapy or like CBT. I never did anything related to OCD. I never been treated for OCD. I have taken SSRIs. But yeah, the hospital I'm in is just talk therapy, and I'm realizing how damaging it is to my OCD because, again, it's like the reassurance seeking and knowing like, is this appropriate? Am I supposed to be doing this? And I'm realizing I need to like a different type of treatment. So I do have like appointment in a different hospital, and I'm hoping like officially starting treatment for my OCD because the only thing I've done so far is just talk therapy. That's all I've done.
Oh, wow. So you go to the hospital. You don't live in the hospital, right?
No, I go once a week.
Okay, you go to the hospital. Okay. And when are they planning to start this?
It's not the same hospital, but I made an appointment at a different hospital for next month. I'm gonna do
Hmm.
an intake process, and hopefully they accept me as a patient, and I'm able to transfer there.
Hmm. But it'll be outpatient, right?
Yeah, outpatient.
Okay. Okay. So do you have certain, we talked about children trigger you. Are there any other triggers that you can think of right now that you've had in the past or you have now?
Yeah, for me, like germs was like a main thing. I have gotten over it, but I do struggle with like, touching the ground, or I have never gone to the beach because I find sand dirty. And so there are things that I wouldn't do. Even like if a friend would invite me to a picnic, I would personally not go because I get very scared because I'm like, oh, then I have to come home and take a shower by sitting on the grass. And another thing, I don't let my family hug me or like sit on my bed because I feel like it's dirty and they're gonna get this like disease from me, which I know doesn't make sense, but it's my mind telling me like I can't. I'm able to like let my friends hug me because like I think I'm like outside, but when I'm inside at home, I'm like I'm dirty, like no one touched me, and I also get like really like unwanted, like violent, intrusive thoughts,
Mhm.
such as like I would be having this conversation with like a stranger or a friend, and then I'm like the false memory comes in. I'm like, did I say something inappropriate? Or if I'm walking, I'm like, did I hit this person by mistake or something? And then my mind tries to convince me it did happen. I just can't remember it, and that's where like all the guilt comes in. I'm like, oh, I'm a bad person for doing that or even thinking this. And lately, the biggest OCD I think subtype that I'm struggling with just started last year. Existential OCD. It's been the hardest subtype for me personally. Losing touch with reality, especially when I'm in public, it scares me a lot, and I don't know how to get it treated. I don't know if anybody has gotten treated for that. But I
And
think
what
that's
is
my.
that? Can you explain that to me?
Mm,
What happens when that happens?
so basically, like you could be, let's say, like sitting somewhere, like let's say a park, and then your mind tells you, whatever you're seeing is not reality. So almost like a screen in front of you, and you're like, I'm watching fake reality, and your mind tells you something else is a reality, and you start questioning it. That's what
Mhm.
happens to me.
Hmm.
Or you could think like everyone's dead and I'm imagining this whole thing, something like that. Like
Okay.
it's all a dream basically.
Hmm. How did you do during COVID? Was COVID easy for you or hard for you being, we were isolated?
I loved COVID because for my OCD because we had to like wear the mask and gloves, and I remember my family would come home and like wipe everything, and I'm like, I will feel like everything is clean right now, and I could clean anything and my family wouldn't get mad at me. And then I could like a bag that I wear outside. My parents were like, "Yeah, don't bring it in the house," and I was like, "Oh, perfect! Like it makes sense to not
Mhm.
bring outside stuff inside." So it was like a dream come true for me.
Everybody's doing what you were doing all along.
Yeah, like
It wasn't seen as weird.
exactly.
Yeah. Yeah, and I was wondering how being isolated was for you too, because there were so many months and months that we couldn't go anywhere. Was that okay for you? I mean, just being isolated?
Yeah, honestly,
Mhm.
I didn't did a good job in those 6 months because I graduated from college in December. So when COVID started slowly, I have already graduated. And then obviously my previous months of classes were virtual. So my job was starting next year. So I had these 6 months of just staying at home. And
Mhm.
it was like a rabbit hole of social media, which I think like affected my mental health a lot. But yeah, just sitting at home and just like going on social media and just like I guess like again like not connecting with people. Yeah, it was hard, I think.
Mhm. Yeah, everybody reacted to that differently. Some people were okay with it and some people were not. So, I got very stir crazy. I wanted to go out.
Yeah.
So, let me see what else I wanted to ask you. Well, so what are some things that you do now to try to, because we know OCD, a lot of times stress makes it worse. Are there any things that you do now to try to relieve the stress, to try to relieve the OCD symptoms? Do you have like hobbies or anything like that?
Um Unfortunately, I don't have hobbies.
Uh-huh.
um because I'm currently isolating myself after losing my job. But yeah, like I did had hobbies, to be honest. Like I would take myself to the park, like a lot of solo dates, which I think I should get back into. But like I feel like not being dependent on other people also helps me where I don't need reassurance for things. So taking myself outside for solo dates and or even asking a friend like let's go check out this place that I really like. I enjoy doing that. And I love being creative. Not an artist at any means, but I love watercoloring. I love knitting. I also love writing, like journaling, or I love poetry. So these are like some things I I can do to stay myself busy.
Well, I'm hoping that this treatment helps you a whole lot. Are you on any medications right now?
Yeah, I'm on two medications. Not on a SSRI or anything OCD related. Right now my severe depression is being treated, so I'm on gabapentin and brufen mainly.
What was the second one?
Brufen.
Okay. Yeah, I don't know what that is. How are you feeling? Are you feeling hopeful for the future, or do you feel like you're in a better place than you were, or a worse place, or how do you feel?
I feel like my OCD, over time, I have learned to manage it personally but independently by myself, and I'm able to convince myself that the thoughts are not real.
Hmm.
So that's been like my OCD is improving. I'm seeing like a lot of improvement, to be honest. Like I couldn't even read a book without like repeating the same sentence, but I'm able to read and be like, okay, like I understand that sentence. Let's move on to the next sentence. So like just like I guess like challenging my inner voice, like the intrusive thought, like okay, I'm not gonna like trust you. And whenever I do get the thought, I'm like I just tell myself like thank you brain for that knowledge, but I'm not gonna focus on it or I don't have time right now. So I kind of
Hmm.
like trick my brain like I'll come back to you and think about you, but obviously I'm not gonna come back and think about like, oh, if you don't touch this, mom's gonna die. Like, no, like I'm not gonna come back to this. But like thank you. I do acknowledge the thought though.
Hmm.
I don't feel hopeful for my depression. Or again with my BPD. BPD is like a really new diagnosis for me. It's been really hard. A lot of the symptoms with OCD and BPD are very relatable, and it messes up my mind because when I'm really stressed out and I do get triggers, I'm like, I don't know if it's my OCD coming or it's BPD, and I get confused. and my therapist didn't know really what to treat, and so we ended up just like ignoring what the label was. We would just focus on treating the symptom, and like I still don't know what is it when it happens to me, because yeah, it confuses me, but I think I have gotten better with OCD though, definitely.
Now, what is BPD when you say BPD?
Borderline personality disorder.
Oh, okay, okay, okay.
Yeah.
All right, yeah, okay. I've had I've had that diagnosis as well. Um, do you think that like watching TV, movies, social media, does that make the symptoms worse?
Social media, yeah, social media, yeah, because I'm constantly scared that I might post something inappropriate. I I do tend to check my social media just to make sure I didn't post something, or text my friend something. Like if I'm mad at her, I have this thought where I'm like kind of like saying things to her in my mind, but I'm like, oh, did I actually typed it out? And that will scare me again. Like the false memory will come in.
Mm-hmm.
Um,
Have you ever deleted like messages to people? You know how you can remove them?
yeah, definitely.
I do that.
Yeah.
Oh, like I didn't say that right. I'm gonna delete that and do that again.
Yeah, but some friends have their notifications on. They're like, I saw that.
Uh-huh. Yeah. Yeah. So, because I was just wondering if like, you were talking about like violent thoughts and things. I was wondering, do you watch violent movies or like horror movies or anything like that? Or does that upset you?
I used to watch a lot as a kid, but yeah, as I got older, I started seeing that horror movies do like stress me out. And
Yeah.
I remember the last time I went to watch a horror movie, my extension OCD that got triggered, and there was like obviously somebody like killing somebody, and started getting a thought that, oh, like, is that me on screen killing somebody? And I got really triggered, and
Mhm.
I have not watched a horror movie after that day, and I don't think I'm going to be honest. I stick with like the happy shows, and
Right.
where they are like, yeah, I can't do like where it's triggering me.
Yeah, that's how I am. I can't really watch. It's people what I find psychologically thrilling. People laugh at me, but I don't like psychological thrillers that there's no blood or gore, but there's just that build up, and something's coming, and I can't deal with that kind of stuff. Maybe just a little bit, but if the whole movie's like that, I can't watch it. It's because you can't really tell what's real and what's not. Something's going to happen and you're not sure what it is. And I don't know, that triggers me really bad.
Yeah, I mean that makes sense because OCD
Hmm.
is like anxiety based, and it's like the uncertainty that, because we don't
Hmm.
know like what is real and what isn't. So it makes sense that you go through that.
Yeah, and the music changes, so something's getting ready to happen, but then they fool you and nothing happens. And then in the next scene the music stays, and you're like, oh, nothing's going to happen, and out jumps the guy. It's like uh, I like things that are more predictable. And I'm like you, I like structure. And I did an episode a while back about like choosing a job, choosing a career, what to think about when you're out looking for a job. And, that might be helpful to you. But that's one of the things that I wish I had done. And I'm glad you're doing this at such a young age, because had I known to do that and think about what it is that triggers me, I would have saved myself a lot of problems in my career, you know. And I think now I'm where I need to be career wise, what suits me for my OCD. That's the reason I got in. I have a business now, and this business helps me with my OCD because I'm a checker. I'm a mental checker.
Mm.
And so if you're a mental checker and you find, um, if it calms you down to check things, then look for a job that is includes checking, like editing or, you know, doing inventory and counting and checking, things like that. And I wish I would have known that when I was younger. So,
Yeah, yeah. Thank you for those tips.
yeah.
Honestly, yeah, I haven't thought of it like that.
Mhm.
I usually I I try to avoid things when it's OCD related based on jobs because I don't want to like my coworkers to look at me like, oh, she's being weird by like organizing something or redoing everything over and over until it's perfect. But yeah, I think like you could use it as like a strength too. I never realized it in that way.
Yeah, because if you're an organizer, even if it's not OCD, but you're just an organizer just in general, then there are jobs that people would appreciate you coming in and organizing things. They don't
Yeah.
want to do it. They're not organized. And they really could care less, but for their business, things need to be organized. So they would hire you to do that. Trust me. And then you also have to think about the social environment. Like, are you going to be more, comfortable in a cubicle where you've got, three walls around you? Or are you going to be more comfortable in an open space where you can see what's going on outside of your space? Some people like to just be kind of boxed in and not see what's on the other side. And then other people, that drives them nuts. You know, they need to be near a window or they need to be able to see what's going on outside of their desk or whatever. So yeah, really, I guess what I'm saying is when you go into interviews, bring things like that up. Like, well, how are things set up? Can I take a tour? Can I see where I would be working? And that it just saves you down the road for problems that could come up.
Hmm.
Then you might end up leaving that job where you could have just found something else and then stayed, because everything was pretty much, what you need. So, but it's a very exciting time in your life, and I'm glad that you're taking care of yourself and because you've got your whole life ahead of you, you know, so you're taking care of yourself now.
Yeah. Thank you for saying that. I do appreciate that and all the tips.
Yeah. Do you have any goals in the future? Like, I mean, do you have any dreams of getting married or having children, or have you not thought that far?
Um, I have always wanted to be a mother. Like I
Hmm.
think like ever since I was little, still do. I remember when I started with the therapist for the first time. She was like precise. She was giving me these medication, and my first question was, "Am I able to like have kids with these medication?" And I mean, obviously, I was young. I think I was 21. Like so the doctor was like, probably like, "Why is she asking this?" But
Hmm.
she told me like something that really bothered me. She told me I don't think you should think about kids with the illness you have. Like you shouldn't be somebody who should be bringing kids in your life,
Oh,
and
wow.
that that has affected me a lot. And I get very scared because I wouldn't want my kid to have OCD, but I have joined these bunch of virtual support groups, and there's a lot of women that feel like this. And I started realizing, if my child do end up with OCD, I can help them because I know how to help myself. And I can tell them these are the coping strategies, like, you have to do if it happens. And, like, obviously, I wish my child doesn't have OCD. I really do pray to God. But, like, if it does, I'm going to be there for them and I'm not going to ignore it as, like, this random thing they have. No, I'm going to know, like, this is OCD and they need help and I'm going to get them help.
Yeah, and that's how you and I, well, found each other was on a social media platform on Facebook. So that's a great place to talk to people. In fact, this podcast also has a Facebook group. We're extremely small, but we're going to grow.
Yeah.
But I had two things I wanted to ask about or add about that. Number one, and you don't have to answer this if you don't want to. Have you thought about anybody in your family that might have had OCD that because it is hereditary in some cases. Is there anyone that you can pinpoint that might have had it? Like a parent or a grandparent or
Yeah, so none of my family members like have mental illness, but kind of found out this pretty late, but my mom randomly told me that my dad would have the same behaviors that I'm doing right now when she got married to him in the beginning, and such as like hand washing, and like I just got a little hint of it, and then that's making me question like, is it passed down from my father? But that's all I know. Like that's the only
Mhm.
thing I know.
Okay. And then as far as the children, I have interviewed at least 3 women, well, at least 2 women that I can think of at the moment who have children currently. And I remember one said that her child has it, and so she was able to see it almost immediately and was able to get her child help and also assist her child. So her child didn't have to wait,
Mm.
7, 8, 10 years. And then the other one I can think of, Jamie, her mom had it. So her mom was able to see it in her and help her from a very, very young age get help. So I'm not saying that it would be great if your kid has OCD, but if he or she does, you're in a great place because you'll be able to recognize it and you'll be able to get that child help from the very beginning. And then they will have a great chance, of managing it. You will be an asset to them.
Yeah, thank you.
That's not something that I'm sorry this therapist said this to you. Of course, obviously, I don't know what's in your head and I don't, I'm not a medical professional, but that was a really mean thing to say to you because I bet it stuck in your head, you know?
Yeah, it has for many years.
Yeah.
Because again, I have this style where I have heard of like these situations where OCD gets worse after you give birth, and that
Mi-
scares me. You know.
Mine did, but however, I was not on medication
Mm.
at the time. And there are medications that you can take while you're pregnant, while you're nursing. You might have to stop some medications, for a while, but there are other medications that they can give you to get you through that period. But,
Oh.
because if you're nursing, you have to be really, really careful what you take. But I do know people who are on at least something, to get them through that. But yes, that is true. My OCD just went full blown after I had a baby. But
Mm.
I was not diagnosed yet. See, I didn't get diagnosed till I was close to 40. I was on nothing.
Oh my God.
So you have, yeah, I've lived with OCD for 62 years. So you have a real leg up here, you have a real advantage that you're finding out about this now. So I think you're going to have a great life.
Thank you for sharing your
Mhm,
experience and giving me hope. Honestly, means a lot.
mhm. Yeah, I'm not a professional or anything. I'm just telling you what happened with me. So, I could be totally wrong, but I just don't see it. I don't see the benefits of telling someone, you know, now again, that person might have meant like at that time, like this would not be a good time right now, core, for you to have a baby. You know, I can
Yeah.
see that. You're not in a good mental place right now to have a baby now. But if they meant forever, I just can't see that unless you're out there physically hurting people or something. you know.
Yeah, I agree.
Is there anything else you wanted to bring up while you're talking? And you're always welcome to come back. I always tell my guests, and I have had a couple guests come back for a second time because they have other things that they want to say or talk about. Is there something we haven't talked about?
Yeah, I recently found out about responsibility OCD and harm OCD, which I personally didn't know. And like for me, responsibility OCD shows up where I am constantly living in the present, in the past, and very worried about the future because of what I did in the past. And it's like I always tell myself, like, again, like, I'm a bad person because I did this in the past. And like my therapist tells me, like, you're taking a really huge burden on yourself by, the blaming and the guilt. But yeah, and then I end up punishing myself by doing these behaviors and stuff. So that's been like really hard. And honestly, the harm OCD is like, I didn't know it existed until very recently, where I've been getting these like suicidal thoughts, but I'm like, I don't really want to act on it though. I'm getting it, and then I found out about it, and just like a fear of like harming yourself. And it has happened to me before where I had this thought, and I ended up taking myself to the ER because I was genuinely scared that I was gonna hurt myself. And like, it doesn't make sense because I won't do it, but the thought is just so real. And it's really hard because you don't know, like, for me at least, especially who's like diagnosed with severe depression too, I don't know if it's like me being suicidal or again it's harm OCD, where getting these random thoughts at the end of the day. And I think it's really hard to like tell the difference, which really, like, I think it's like a really huge reason why it's hard for my treatment. So yeah, I just want to share that. Thank you for
hopefully the professional that you see will help you sort some of that out.
Yeah, thank you.
Yeah. So I always ask my guests at the end if there's any words of wisdom you want to leave for our listeners, because they tune in because they want to listen to someone that they can relate to. And, I'm sure there's someone out there who's going to hear this and relates to you, Kaur. So any words of wisdom or something that you want to share? It could be a saying, anything.
Yeah, I would just say, like, you're not alone. I have felt alone for a very long time, and I know it feels like a war inside your head. I always felt like I was born with these two brains that's constantly fighting each other, and I hope one day we're able to listen to like our voice and not the OCD voice. I hope we're able to, like, I don't know if there will ever be like a cure for this. I don't know if there is, to be honest, but what I would just give, like, offer advice is, you don't have to do this alone. For me, finding support groups on Facebook, Instagram, or Reddit is helping me a lot. Just telling people about my struggles and getting even coping strategies from them and work for them has been more useful for me than what a therapist has given me. So I would just say, like, try to find people who have the same problem as you instead of like trying to face it alone.
That's very, very good advice.
Yeah.
I would love for you to check back in with me, on Facebook. Let me know how you're doing. Okay?
Yes, I will love to.
I'm especially excited to hear what you decide to do in the future. Thank you for joining me. We're going to end here. Everyone, thank you for joining us. Have a great day. What a delightful conversation. I know some or all of you related to Kaur's story in some way. Don't forget that the podcast has a Facebook group by the same name. We're a very small group, but we hope to grow. In that group, you will find people who will listen and support you on your OCD journey. If you or someone you know would like to share your experience with having OCD, please message me at one of my social media links below. Join me this Thursday morning for another midweek motivation and a full episode bright and early Monday morning. Remember that while OCD cannot be cured, it can be managed, and I am living proof of that.